Back in January of 2021, we convened a group of our local providers, kind of a broad stroke of people who have some relationship to end-of-life care and care for people with serious illness. And time and again, the conversation came back to grief. The local sentiment was that there simply wasn't enough services, that for Spanish-speaking community members, there were even fewer options, and that those organizations that did provide care and did provide services were deeply constrained by fiscal limitations and resources. So that sparked a conversation at Hospice Giving Foundation among our board and staff to think about what are some of the solutions that we could come up with for this issue. This sounded like a very serious need in our community. And that sparked Heal Together. In April 2021, our board of directors established the Heal Together grant. Now I have to have these back. We established this as a 2-year project. And the thing is, we knew we couldn't do this without partnerships from the community. We knew while we could come in and start it and own it and launch it, we needed help from the community to make this happen. By asking people to support this and be funding partners with us, that accomplished a couple of things. One is, there was a clear message to the community that I see you. I see that you're in pain. And what we can do to help, we will do to help. And people need to hear that when they're suffering and they're grieving. The other message was to the people providing services, thank you. I know you can do this. And we're willing to commit more resources so that you're better able to do this. So those two messages were really the driving force in the conversations that we had with other funders to see about making some partnerships really happen. And I will also tell you that in all of those conversations, invariably, the conversation flowed to their pandemic-related losses, the things that they suffered from and they witnessed with themselves, their families, their coworkers, their employees, their friends and neighbors. The list went on because this grief from this pandemic has really affected all of us in some ways. So to date, this fund has grown. The foundation started with the initial $500,000, and now this fund has grown to $1.13 million. And we are still growing. We are still working toward our goal of at least $1.5 million. This was made possible because of the incredible generosity of our funding partners. They include Hardin Foundation, Monterey Peninsula Foundation, Sally Hughes Church Foundation, the Rotary Club of Carmel by the Sea Fund, and the Yellow Brick Road benefit shop, as well as a number of individual donors. Steve John from Monterey Peninsula Foundation could not be here today, so he asked me to share his quote with you. So I will read that to you. Monterey Peninsula Foundation is deeply committed to the long-term health and well-being of our region and is proud to support this initiative to bring healing to the members of our community most impacted by the pandemic and its ongoing effects on mental health. And that's from Steve John, the CEO of the Monterey Peninsula Foundation and the host of the AT&T Pebble Beach Pro-Am and Pure Insurance Championship. This is the depth of commitment that people came forth with. Most of them didn't hesitate. Most of them said, oh, thank you for doing this and for getting this launched. So simultaneous to raising the money, we had to determine what the fundamentals and the priorities were for Heal Together. This was taken on by a small committee of great people with expertise and good community connections: Ida Lopez-Chan, Barbara Collins, Kim DiBenedetto, Deacon Warren Hoy, Bree Nakashima, and Bill Tebby. They determined that for the greatest impact, Heal Together would support an expansion of a coordination of services among other agencies, most certainly bilingual, bicultural services, and a coordination of a breadth of services that gave people options for the kind of care that would best fit their needs. Finally, providers would get paid more for the individuals that they treat, and those who come to get the services regardless of their ability to pay. So we're talking about access, expansion, and coordination of many different organizations through the community. So today, it brings me enormous pleasure to announce that the Heal Together grant has been awarded to Coastal Kids Home Care, who is establishing the Heal Together Hub to centralize resources, coordinate services, and expand care. We are so excited by this team. They bring grit and tenacity and heart to their work, and they have made a commitment to really bring this initiative to fruition. We are very proud of them, and we're excited to support them. And we really hope the community will join in with us and continue to support this wonderful initiative. Help us reach those goals and even more, because the more we can provide in terms of resources, the deeper and the better the services will be for our friends, our family, our neighbors, our coworkers who are grieving and need our care and support. So without further ado, I am now going to introduce a couple of other great people who are here to talk a little bit about Heal Together. First, I'd like to introduce to you Dr. Wendell Harry, who is the Medical Director of Palliative Medicine at Natividad, who will share his perspective on Heal Together. Thank you.
So you can see me struggling as a physician to have my mask off for moments at a time. It just doesn't feel right. To introduce myself, I'm a physician in this community for now more than 25 years. I came here for residency and became a full-scope family physician, delivering babies, doing surgeries and procedures, caring for children, parents, elders. I have worked everywhere. Clínica de Salud, Natividad, Salinas Valley Memorial Hospital, HIV specialty clinics, home health agencies. A decade ago, I turned my focus towards the care and support of those people and families with serious life-limiting illness. I sought additional specialty training. I joined the specialty because its primary goal is to help persons living with an illness that is going to shorten their lives to live as well as possible for as long as possible. When I meet a patient or a family for the first time, I explain that I'm part of the quality of life team and that we are here to support you and your family, that we work to prevent and relieve your suffering, whether from pain and nausea, shortness of breath, whether from the stressful confusion of not understanding what the doctor or nurse just explained, or whether from the sleeplessness and anxiety that comes with being a caregiver for your loved one who is more sick than you have ever seen them, or from the existential distress that can come with facing our own fragility and mortality as a human. That specialty, that team, is called palliative care. What the heck does that have to do with, with grief and bereavement, with healing together, with sanando juntos? Because palliative care, as we know it in Monterey County and surrounding counties, would not exist without the material support of Hospice Giving Foundation for now more than a decade. Palliative care team staffing, literally the actual staff, at all three major hospitals, palliative care advanced care planning in local nursing homes, advanced care planning and grief support workshops in our community would not exist on the level that they exist now without Hospice Giving Foundation. So it's from that context that I'm speaking to you today to thank Hospice Giving Foundation for addressing what I, as a family physician, as a palliative medicine specialist, consider the greatest deficiency in modern, high-quality, high-tech medical care for persons with serious illness. It's not a shortage of medications. It's not a lack of medical devices or ventilators or PPE. It's not a lack of highly trained subspecialists. The greatest deficiency I and my colleagues in the hospital, in the intensive care unit, in the clinics feel every week and sometimes every day is the lack of advanced preparation for and support through bereavement, loss, and grief. When we focus, we, the medical community and our society, when we focus on medical technologies and procedures and medications to sustain, let's face it, to sustain heart and lung function while missing the many opportunities to anticipate grief, to prepare for loss, to support families spiritually, emotionally, mentally, and to meet patients where they are on their journey with serious illness. We ignore, we underestimate, we underprepare for impending grief, and I mean this sounds a little melodramatic, but we may actually amplify the suffering of those who are left behind, the family, the friends, the caregivers, and the medical care providers. We may magnify what was to be an untimely or an unfortunate loss into something that is felt and forever remembered as a tragedy. Then add in familiar barriers in our community of language, culture, limited medical literacy, the limited availability of trained bilingual clinicians and support staff, the inability to visit your dying loved one in the hospital because of COVID. It just gets more tragic. The unmet need for grief support in our community starts to seem overwhelming. And yes, I have been overwhelmed recently. The existing community agencies are doing a great job. They're doing the best they can, including local hospice agencies, but it's just not enough. So, that said, thank you, Hospice Giving Foundation. This is incredibly timely and important. Thank you for your support of palliative care, of advanced care planning, and today, what I'll call an accelerated support of bereavement and grief in our community. I would consider you high in the ranks of the heroes of this pandemic, and you're becoming our safety net for the loss and grief of this pandemic, as well as the loss and grief before this pandemic and hereafter. All that said, I'd like to introduce Kimberly Craig, Mayor of Salinas, for her comments.
Good morning, everyone. My name is Kimberly Craig. I'm the mayor of Salinas and also have a side hustle as a board member for Hospice Giving Foundation. Just a little personal story about me. I joined Hospice Giving Foundation in July of 2020. Thought it was a great opportunity to get a younger generation involved in advanced healthcare directives and understanding end-of-life care. Unexpectedly, in August of 2020, my mother went into hospice care. And so it hit home for me very, very quickly. She passed in October of 2020. Dr. Harry was talking about palliative care. I like to think I'm a relatively educated woman, had no idea what palliative care was, had to have that rather large and unexpected conversation on a very personal level. I got caught up to speed very quickly. But what I would just share with you is that the great work that Hospice Giving Foundation does in our community, you know, I've been on a lot of nonprofit boards, and what I would share with you is that there's an incredible awareness of reaching all members of our community, all members of our area, not even Monterey County, Santa Cruz County, San Benito County. And one of the things that, as the mayor of Salinas, as I came on board as the mayor in January, the recognition that there is a large group of our community that doesn't understand hospice care. And that is the community, our Latino community, and really understanding that residents in Salinas, residents in South County need to be better, they need to have that knowledge of what's available to them. And I think Hospice Giving Foundation is really moving forward in that direction to reach the communities that need to know that there are grieving resources, need to know that there's palliative care. One of the things I will just say about Coastal Kids Home Care is the amazing work that they do here in the Salinas Valley, maintaining the quality of life for low-income and critically ill children. I don't know, that is yeoman's work as far as I'm concerned. And there's an opportunity here, I really think, with the partnership and Heal Together to maintain great relationship with Hospice Giving Foundation and Coastal Kids Home Care for the Heal Together program. I feel like they are the ones to make it happen, and thrilled to be a part of it. As the mayor of Salinas, I couldn't be more prideful of also being a member of Hospice Giving Foundation for the work that we're going to be doing with Coastal Kids Home Care and the Heal Together program. I think there's a lot of work to be done. I'm excited that both organizations are motivated and challenged to get to that large population of our community that needs to know that there are resources available to them. So great work on everyone's part. Thank you to the foundations for their contributions. I have to give a shout out to the Yellow Brick Road Benefit Shop. They are great people in our community that have donated throughout the entire county. And just on a last note, the community-wide initiative, you know, I would say absolutely there's work to be done on the Monterey Peninsula, and there's work to be done all over, but really I think where this is going to affect the most change is in the city of Salinas and the Salinas Valley. So thrilled to be a part of it and super excited. Thank you.
Thank you, Kimberly. Thank you, Dr. Harry. And I'd like to welcome up Board Chair Kim DiBenedetto for the big moment.
Good morning, Kim DiBenedetto. I am honored to be the chair of the board of directors for Hospice Giving Foundation when I'm not professionally volunteering. I am I am a real estate professional with Carmel Realty Company. So it gives me great joy to be part of this group and to have such great board members. So we're going to do the check presentation to Margie Mayfield, who is the Executive Director of Coastal Kids Home Care, in the amount of,
And any team members who want to
and any team members that want to come up, board members.
Never thought we'd fill this room. It's so great.
Bill Tabby gets in the back.
Yeah. Hospice Giving Foundation is proud to present this check in the amount of $1,138,175 and growing to Coastal Kids Home Care. Yay.
And please welcome Marjorie Mayfield, and let's hear from her about her excitement with her team. And we're very proud to have her up here. Thank you, Margie.
I can't even believe this day is here. I can't believe this room is full. We're so blessed to even be in this building, and so welcome everyone. I'm going to start with my glasses because that's who I am now. Can't do it anymore without it. We're there. Thank you, Siobhan, the Hospice Giving Foundation Grant Committee, for entrusting us with this crucial program to our team at Coastal Kids Home Care. We are humbled to have the opportunity to lead the effort to bring hope and healing to our community in this difficult time. Coastal Kids Home Care has been providing end-of-life services for children since opening our doors in 2005. Bereavement care for parents, grandparents, and siblings has been an essential component of this service. In 2020, we were honored to incorporate the bereavement groups from the Papillon Center for Loss and Transition into our programs. Already this year, we have served over 250 individuals. When we learned about Heal Together, we immediately recognized the urgency of the need. Applying for the program seemed both a natural extension of our current services and an opportunity to forge connections with providers in our community serving critical populations. Going forward, the Heal Together Hub offers a central resource for bereavement, education, and care. With trained medical and mental health staff services available for intake and dynamic bilingual outreach team, Coastal Kids is grateful to help. Recognizing that our expertise is serving children and family, for this experience for this effort, we will capitalize upon the talents of our partner agencies, with experience serving other populations including the Center for Community Advocacy, Alliance on Aging, Harmony at Home, and Salinas Valley Memorial Hospital bereavement groups. Heal Together prioritizes improving access to bereavement care for those populations most affected by COVID-19. To reach the Spanish-speaking community, we will collaborate with churches, schools, and community health workers. Overburdened healthcare workers and mental health professionals are a priority group. Our Coastal Kids Home Care team knows the firsthand impact of caring for individuals at the end of life and the importance of self-care. An additional focus of our project is to address the current lack of mental health services and professionals in our community. Heal Together brings expert grief and bereavement training resources to this community. In addition, we will coordinate closely with CSUMB and other schools to create a pipeline of providers. We are so excited to launch Heal Together Hub today. Services are already available, including bilingual bereavement groups, one-on-one counseling, and art and music therapy for children. Going forward, this array of services will grow to include walking clubs, yoga classes, meditation groups, and many, many more. Thank you, Siobhan, for sharing your vision with us. Kim, the grant committee, and this incredible group of funders for trusting us to lead this effort. Finally, I'd like to thank and acknowledge the efforts of our Heal Together team at Coastal Kids Home Care, especially Ruth Shapiro, Elizabeth Riorete, Virginia Carlos, Joy Smith, and the whole gang at Coastal Kids Home Care. We are humbled and grateful to offer a pathway of healing for our community. Thank you so much.